Hello, I'm Pharmacist Virginia, and in this video we are going to talk about treatments for chickenpox spots. They are itchy and they fill with fluid and then they burst and they can get infected. So what can we do to treat chickenpox spots? One of the most common treatments is this. This is Calamine lotion, and you have to shake it before you use it. So do make sure that if you open it and you see two separate layers, you need to shake it before you put it on the skin. So chickenpox spots can be infectious, which means that when you touch them, it can spread the virus. So you can apply it on the skin with a cotton bud, and that also helps prevent the liquid from going everywhere. So Calamine lotion will dry on the skin. It won't stay wet for a long time. It normally dries after a few minutes. If you want, you can use Calamine cream instead. So this is easier to apply. Again, you can apply it onto a cotton bud and then apply it onto the skin, and you can see it's much thicker. So it's easier to apply, and again, it will dry on the skin just like the Calamine lotion. Another treatment you can try is a chickenpox cooling mousse. Now this is quite foamy and it's like a liquid, and you spread it over the skin to help to cool the skin. So like the Calamine lotion, it will help to prevent the itching feeling from the spots, and you want to avoid itching the spots so you can prevent breaking the skin and causing an infection. There's also this spray, which is a cooling gel, and it has a little protector on it to stop it from spraying. So if I twist the protector to the right way around, then I should be able to spray it. And this is a brand new spray, so it might take a few goes before it comes out. There we go. So the cooling spray again is very liquidy. You spread it along the skin and it makes the skin shiny just like the mousse, and it helps the skin to feel cool. There's also a cooling spray which you can use, and this is for children that are over 6 years old, and adults can use it too. And its main ingredient is witch hazel and also linalool. So with any medicine, make sure that you are not allergic to any of the ingredients and that you can use it for your age group. So you simply just spray on the skin, and it smells quite nice, and it provides a nice cooling effect on the skin. Another cream you can use is called Crotamiton, and this is another soothing cream. This is a brand new tube, so you turn the lid upside down to help the cream to come out, and it's under a bit of pressure, so the cream just squeezes out like that. And it's quite a thick cream, and it will help to reduce the itching feeling. So again, we want to avoid itching, to avoid breaking the skin, which can lead to an infection. And sometimes you can have bacteria under your nails, which you can then get under the skin, which can lead to an infection. This is an antihistamine cream called Mepyramine maleate, and again, it's a brand new tube, so when I open it, I'm going to turn the lid upside down and use the pointy bit in the top to open the cream. And as an antihistamine, when you put it on your skin, it will help to reduce the itching, and it works in a different way to the other creams because it stops the histamine, which is the chemical that your body releases when you break open the cells, and histamine is the thing that causes itchiness. So there's also hydrocortisone cream, which is for older children, and you should only use hydrocortisone cream after speaking to a pharmacist or doctor. You should only use it on skin which is not broken, and hydrocortisone cream can help the skin to heal faster, but you should avoid using hydrocortisone cream, again, only unless it has been recommended by a doctor or pharmacist who has had a look at the skin. There are also antiseptic creams. So on my right, I have an antiseptic cream that has cetramide and chlorhexidine digluconate. And then also this cream has phenol and chlorhexidine digluconate. So the main difference is that this one has phenol, which is a type of alcohol, and that can cause like a stinging sensation on broken skin. So if the skin is broken, use the light blue one, the cetramide based one. And then if it's not broken, you can use the dark blue one, which is the one with phenol. And antiseptic creams help the skin to heal, and they are normally quite thick and they tend to provide a cooling effect. And with chickenpox, the skin can get quite dry and that can make the skin more itchy. So when you use a cream, then the cream will be water-based and that can help to add moisture or rehydrate the skin. If you're worried about some of the spots getting infected, and again, the skin is not broken, you can use something like an iodine spray. So iodine is antibacterial and it helps to kill anything on the skin that might be causing an infection. So when you do use iodine spray, it does colour the skin, and you need to make sure you do not inhale the spray, so do not breathe it in, and you keep it away from any clothes or any surfaces, because iodine does permanently stain anything that it comes into contact with. So iodine is also used after surgery to help wounds to heal. And so this would be one of the last resort kind of antiseptics if you want to use it to help prevent an infection. If you are going to apply chickenpox medicines, consider using cotton buds to apply the medicines, or wear some disposable gloves to protect your skin. And if you do use your bare hands, make sure that you wash your hands with soap and water, and also wash underneath your fingernails as well. Thank you so much for watching, and I hope you enjoy the next video.